So, Mr. Adam, when you came to our clinic first time, you had so many problems
Yes.
with your depression and digestive issue, mood swing. You was not feeling yourself.
Right.
Could you describe how you was feeling before when you came to our Center of Integrative Medicine?
Yes. So before meeting Dr. Hock, my life was pretty much the opposite. I used to feel very depressed, like all the time. Very negative thinking. Also, like emotions, like my emotions pretty much control me, like day to day, and it was very, very hard to get through pretty much the normal daily life. Like just waking up in the morning was difficult sometimes, and it was for a very long time. And that also led me into having no motivation anywhere else in my life, that I just let everything get, I guess, bad because I just didn't care for it.
You just living on the caffeine, that's what you mean?
Yeah, pretty much. Like you just have no motivation. You just don't care anymore.
Oh, you don't care anything?
No, you don't.
You
don't
have no hope for your life?
You
So-
stop caring about everything.
Everything.
Yep. Even yourself, and that's when things get bad because you're trying to find a way to feel better. So you may run into things that aren't so good for you, that may give you some kind of like instant gratification, but it's only temporary. It never fixes it. It's just a bad day.
Did you try some specialized doctor who can give you some pills for depression and mental issues and your health, digestive tract
Yeah.
and your energy, motivation?
Yeah, so the depression was something that I was not aware of, actually, because it was part of my life pretty much since I was a child, and I just never noticed it. And it wasn't until I grew older and I got in a better place where I started to notice things about myself. And one day I just paid attention to like one day of my life, and I looked at it from like a perspective outside of me, just observing without judgment. And then I realized that it was pretty sad, like it didn't look happy, it didn't look inviting. My laugh did not look
Yeah, I remember when you
good.
came.
Yeah.
I remember when you came first time, you was dragging your body. You
Yeah.
have no energy. Your skin was dark. Now you got back your skin.
Yeah.
I'm so glad about that. And
Yeah.
you have a lot of digestion problem. How's your digestion right now? You can digest food now?
Yes, it feels good. It's really interesting. Like just like something that's going to the bathroom has become like a daily thing when it didn't used to. Like I used to hold it for days and
Days.
Yes.
Wow.
But I know that it's because of a lot of the foods that I would eat. Because I will run to food to make myself try to make me feel better.
So now are you eating healthy nowadays?
Yes. Yes.
So maybe you can describe a little bit, for our, people who are watching.
Yeah.
They can get some motivated.
Yeah.
What after fixing your, anxiety and depression, after fixing your gut, now of course you wanna continue the healthy diet.
Right.
Could you describe a little bit shortly what healthy eating you're following after being
Yes.
recovered?
Yes. So pretty much, food is very important, and that just pretty much dictates how I feel now. So I try to be mindful about what I eat, which includes vegetables and fruits. A lot of the vegetables, I try to eat them as raw as possible, like salads, and sometimes I'll drizzle a little bit of like olive oil. Just keep healthy fats as well, like avocados, vegan cheese, vegan butter, and even sometimes dessert, like some Greek yogurt with no sugar and dark chocolate and a little bit of honey, and that's
good.
it's actually pretty delicious to eat like that.
Yeah.
Yeah.
So eating healthy fat,
Eating healthy is very delicious.
very delicious.
Yes.
Body is natural.
Yes.
it click with the natural healthy food.
Yes.
You know, we just need to learn it. A lot of time we are so much junk food around.
Right.
We forgot our right food is so, you know, so filling and so
nourishing.
And body wants that.
Yep.
Just need to just learn and get used to it.
Yes.
And once you get used to it,
Boom.
Yes.
it's very easy. Once
Very
once you
easy.
become educated,
You actually
on
crave
nutrition,
it. You
Mhm.
start craving
Yeah.
the good food.
Good food you crave.
because of how they make
That's
it.
a
feel.
very
It
good
create-
point, though.
It creates like a mental thing where you see something like Taco
Yeah.
Bell or something, and
Mhm.
mentally you're like, I don't want that near me.
Because you
it
remember
creates-
how you feel.
Yeah,
How you was
it creates like a
feeling.
mental
Yes.
like an intense disliking for
And,
just mentally
yeah.
thinking about it. It's like I
Yeah.
already know what that path leads, so I don't want that. You know.
Mhm.
Yeah,
Mhm.
absolutely.
Yeah,